morning to you. And of course, a very good morning to our special guests who are here from the community practitioners registration council of Nigeria. We're here for a taxi visit to the office of the Vice-Chancellor and the Secretary, and whatever they are about to say, we will get to know in a very
Ladies and gentlemen, my visitors, I'm glad to lead this delegation, and we are pleased to be in your university. On behalf of the registrar, community head practitioner relation department, Dr. Bashir Idris, representing Jaman, we plan almost everything to come from his office, but the minister just called him that he has a meeting with him by 11 o'clock. 5 years, lots to do with us. Circumstances has prevailed. So, said I should extend this heartfelt greetings for you granting this important policy visit to your university. My Vice-Chancellor, sir, we are here to solicit your cooperation so that the university can mount the Bachelor of Computing and Science program. Knowing quite well that we have large followers across Nigeria. It is very, very important that this meeting is just rekindling of what has happened in the past. So we go into the archives to see the history of the efforts the government made to mount this program for the benefit of humanity. We have a very large followers that are spread across grassroots areas. That is people we call ourselves practitioners. Let me use our community health practitioners. That is the essence of why we are here, so that we can be able to discuss modalities on how this can be actualized for the purpose of humanity. Thank you, sir. Let me go to Dr. Gimbason.
Once again, appreciate the reception given us. However, it's like we are coming here as reaffirmation. We have already been together for some times. We have not been able to formalize anything. So we are coming in here as a group to incorporate ourselves and move as a team for the purpose of humanity. So, sir, we just came in with a few things in terms of my request, hoping that you and the management team will look alongside what we are presenting before you, and then give it a better view of how it's supposed to be. In the first place, of what we want to, the community health board wants to establish the PCHS project, which already the conventional universities are running some of these programs. As I'm talking here, the primary health, the regular PCHS program, and students volunteer and so we want to propose the program. Because most of our practitioners are already practicing on the field. So we want it to be a sort of giving them a succor when they come to Open University. So far they are already civil servants and others, to give them a better chance to even run the program here than to go for the conventional one that you are going to stay over there while your work suffers. So these are the things we want to talk about. We have two cadres, which is the community health extension worker, who spends 3 years in the College of Health Technology. Then we have the community health officers. He has the CHU, which is the community health worker, and then community health officer. This training is done at the teaching hospital. And we want them to come in for the BCHS program. And the first set, which are the CHUs, they have diploma. while the others said the CHOs have HND. So, and these are the group of people who want them to come in. And then the mood of their entry, based on the papers they have and their profiles, is that the two who are the diploma holders could come in at 200 level. Then the CHOs will come in at 300 level. And the reason is because of the 5-year program counts that the minimum we should have the credit units is 150. So with these people having their, like the two are coming in like direct entry. Then the CHOs are coming in just a little bit because they already have their HNDs. So they will come in 200 and 300 level respectively. And then continue the program the way it is. And if that is accepted and they come in, then it's a professional training which they will need to come, and that which they will do is like we are having collating their data in terms of the professionalism. So we have what they will come in with indexing. So when they come in, the indexing generally is going to take place at 200 level. The indexing is that you index yourself, is like matric number. And you index yourself to identify yourself with the professional body that you are part of them. So after the indexing at 300 level respectively, then at 400 level, those students will register for the professional exams at 400 level.
Licensing.
So the licensing exams the registration of that comes at 400 level. Then, after that is done, then at 500 level, then they will now sit in for the professional exam, which gives them the license to practice. So at 500 level, first semester, if they're able to write their professional exams, then at the second semester in the 500 level, they'll write their BCHS exams. So they are now graduating with the Bachelor of Community Health Science and then with the professional certificate to practice as community health officers. So these two, they come out with it. So these are some of the things we have. And then graduating and licensing, which already we have just said it. Because when you graduate, you must be licensed before you practice. And because of this program, by the time they graduate and they are given the license, they go in for internship. The internship is 1 year. After the internship, then anybody who is qualified to go in for NYC, you go in for it. If you don't have it, they either get the exclusion or exemption. So based on the age you are graduating. So this pick them together, and then the other aspect of it that we want to talk much about is that we want to get some clarifications, sir. And these clarifications come in this way. Already, the board were intimating the university sometimes, but we had never come to an official agreement on what to do, especially the MOU. So the board now has the interest to come back and then discuss the MOU that is going to be signed between the university and then the board on how to facilitate this training. So these are some of the things we want to put across to you, sir. And that is the next one. So also, because the program has different courses, so we want to also see whether the board can come in with the university in the development of the training modules. Because these modules will be developed and then be put the professional courses that will have to collaborate and then develop the training modules. So who is to be involved in those training modules is what we will need to discuss with you, sir. And then, then in this course of that, there should be preceptors. So the preceptors and the monitoring of the program in terms of clinical postings So also to who are going to be part of the preceptors. Because some of us I've been a preceptor with the Open University under public health for more than 10 years now with Just Center. So we want to put that together and see who are going to be part of that. And then also, most importantly, is the representative as a coordinator who will coordinate along with the head of department, who will head the department here, who will have a coordinator who will be a licensed practitioner in community health, if possible to be liaising with the head of department and coordinate the running of the activities of this program. So into that, if that is well discussed, then we'll have much to go along that. And then assigning, as I've already said, could be someone from the practitioner body. And then also we want to have, if possible, a room be given so that we will have some adjoint participants, lecturers, so that we'll put together with those already on ground. So this adjoint engagement will now help. If any issue will come, they will know actually there are people already on ground. And then if we kickstart whatever come, and they are able to give us a good feedback, then the university management will decide who and who to incorporate into such trainings. So these are some of the few things that we feel we should put before you, sir.
30% curriculum.
And then the curriculum, this is it. The 70% sent by NUC, and then the 30% that has to be made 100%. However, the registrar constituted a committee, and what the committee did was to develop, out of the 30%, they developed like 20%. So like that we develop 20% based on our because yes, because some of the professional programs were not included in the NUC requirement. So the 10%, we left it for local content of the university. So what the university has other local content that we put together with the 20% and add it to the 70%, then it gives us 100%. So, and these are the hard copies of the listing. We can still give out the soft copy when the need arises.
From what you said, well, one of my teachers he said he went for an interview for employment. He went for an interview for employment, was looking for a job. And he got there, and they were asking him, are you ready to come? The people who were interviewing asked him, are you sure you are ready to?
So that he can start the work.
You can start work that day.
So that is the scenario I see here.
Okay.
We've been working towards establishing a BCH program. And you are coming to ask us, you're coming to beg us to establish a BCH program. So the issue is, since the person who you are begging is also begging you, we are on the same page.
Sure.
The BCH is an academic program.
Surely.
And it is the University Senate that has the powers to stipulate what should be done and what should not be done.
Sure. Exactly. Correct.
It is to that extent that what we have is university. It is our responsibility as the university to prescribe. The first request you made, establishing a BSc, is our business, and we have done that. And the only thing is this: you have many people who are working who need to come and acquire this thing. I am happy. You know, when the UN started nursing program, there were very few universities in Nigeria that are awarding BSc or for this thing. When we came, and now when we say we have produced over 60% of this thing, they start saying we should withdraw it. We have the vehicle, and that is why government gave us the mandate. Government gave us the mandate to open up the barrier, to remove the barriers.
Increase accessibility. And
increase access to higher education. So the benefit is that those who are working can seamlessly key into our program and graduate. So we were interested in doing this thing. Sorry I said this thing. When we were being trained for evangelism, they said untold millions are still untold. Untold millions are still untold. Untold millions are outside the fold. So we want to bring that untold millions of your people into our fold, or into your fold. We want to be a vehicle to help you. This, because some of these people, they have the skill, but they don't have the qualification. Many people in nursing could not advance beyond a certain level. But when we gave them degrees, they could not become directors and what have you. And they now begin to fight us. You see, that's the danger. I must say it.
That's true.
So, we are ready.
Okay, sir.
But you people should note this beginning.
From now.
You people should note this beginning. Not tomorrow when we say this, you say, no, now is this, now is that. We are ready. We want to partner with you. Our business is to make education inclusive, so that the person who did not acquire education because of one or another and is already working, we can make the best, and even bring the young people who want to. The only problem I know is that I know that in the first 5 years we'll get most of our students from your category. We'll make the money. That will be good for us. But you people remember this beginning. Now, like what I said, you were now giving us the conditions. Even for our admission, you're telling us what to admit them. No. It's our business. You give us what you have.
Okay.
We assess you and know where you have to begin.
Okay.
We even want to admit people from the beginning into a 5-year program.
100 level.
Into the 100 level.
Yes. Through JAMB.
Not through JAMB, not once you are qualified.
Okay.
That's why I say we are the people. Don't tell us our job. Tell us we know how to help you. Don't tell us how to help you.
Okay, sir. Good.
So we will even recruit. We even have people into 100 level who will come and look for a job. Not those who are looking for certificate because they already have a job. But these are categories. Now they choose. If a Jew has a pass, we may start to admit the person into 100 level.
Yes.
So they present the certificates and they will look at our own guidelines. We have provision for 100 level, 200 level, 300 level. We have and we decide.
We have the place.
Because all the ones you were saying, indexing, registration, licensing, fine. Professional bodies have their procedures. There is always a handshake between professional bodies and the universities. It's always a handshake. All those ones will be teased out as we continue in this thing. The National University Senate will award the degree. And the NUC has provided the regulations. We will now know what your body needs. And it's our business to see how we'll incorporate that. The important thing, I want to say this again. I want to reiterate it. The important thing is that what somebody what our student needs to be registrable or licensed by your body should be made available to us. That is what you need to make available to us. Not to tell us you want to provide a go-ahead. Definitely, we need your people to work, to provide that professional component. There is no way we need it. For us to appoint you as a preceptor or even as an adjunct lecturer, you bring your CV, we assess you, know whether you are qualified. So we will do, but it is only those who are qualified. We will determine those who are qualified. And we will engage them to provide that aspect of the training that our students need. So please, we really welcome your request. Our ideas are in sync. It is the implementation. Whatever thing that we need to do to work with your board, we will. But we will always recognize that your board is a professional body and not the awarding, and not the degree awarding institution. We are. And NUC has their regulations. We, the NOUN Senate, also have their own regulations. We will incorporate your own requirements, make sure that we work and produce students who are worthy in learning and in profession, not character. To be this thing. Thank you very much.
So thank you so much, Registrar. You have come at the right moment, as the Vice-Chancellor rightly said. National Open Universities doors are open, that at the headquarters. But outside the headquarters, we don't even have a gate. So the Vice-Chancellor will direct as appropriate and will get back to you as soon as possible to see the possibilities of starting this course quickly, particularly that the CCMAS is here. So your team and our team, by the directive of the VC, will now work and see how we proceed from there. So once again, thank you very much for recognizing National Open University, and we wish you a safe trip back to your respective destinations.
It's a privilege and honor for us.
Thank you, Chancellor.
The camera should get this bag whatever. I know that this bag is not enough. So this is the modern version. So that those my sisters there, when you are going for Ogumbochi, you have a bag to carry. Thank you very much.
Thank you so much.